Hello, my name is Hunter Stafford, and today I will be presenting on the impact of COVID-19 on the perceived stress levels of Division II student athletes. On behalf of my peers in the University of Indianapolis Exercise Science faculty, I want to thank you for listening to this presentation today. It is well known that student athletes experience a lot of stress around both the balance of student life and athletics. Along with this, the COVID-19 pandemic may have impacted stress levels of student athletes regarding their physical, mental, and emotional health as they experience interruptions to both training and competition. The purpose of this study was to assess the perceived stress levels of Division II student athletes following the interruption of their training and competition due to the COVID-19 pandemic. It was hypothesized that perceived stress during the pandemic would be higher in COVID-positive athletes when compared to others who were quarantined due to contact or students who were not quarantined or diagnosed. Methods for this study included student athletes at the University of Indianapolis participating and voluntarily completing an online self-reported demographic questionnaire, along with a COVID-19 questionnaire and the perceived stress scale. This is a 10-item questionnaire that measures the degree to which situations in one's life are appraised as stressful. Students were then placed into 3 groups depending on their COVID-19 status. That is, they had tested positive with or without symptoms, were quarantined due to close contact, or had no direct interaction with COVID-19. A one-way ANOVA was used to determine the difference in perceived stress levels among the student athlete groups, and an alpha level was set at 0.05 for statistical significance. This is a simple representation of the PSS, which measures how unpredictable, uncontrollable, and overloaded student athletes found their lives to be at the time that they completed the survey. This is also a simple flowchart of our methods from start to finish. The results of our data collection showed that perceived stress scores were not statistically different between the 3 groups. The results of this study refuted the original hypothesis, and interestingly, the data demonstrated that athletes who were not diagnosed or quarantined and had similar perceived stress to other athletes who had tested positive. Due to this finding, it could be that the athletes who had not been exposed to COVID-19 or were required to quarantine may have experienced higher stress levels due to their fear of contracting the virus. Furthermore, these athletes may have also had increased stress due to their teammates testing positive and/or missing training or practice in competition. It's unclear how the relationship between perceived stress scale and the COVID-19 interaction may have impacted student athletic performance and preparedness during the 2020-2021 athletic season. One study limitation was that no qualitative data was collected at the time of this study. Because of this, we were not able to identify specific sources of stress that may have been eliminated by being in quarantine. It's important to note that the PSS only quantifies general stress rather than stress caused by a very common source. Additionally, the limited participation across all university athletic teams impaired the ability to further compare contact versus non-contact and male versus female athletic teams. Future studies should investigate the personal impact of COVID-19 on the athlete. So for instance, had the athlete lost a loved one or a close friend due to COVID-19, that close loss could be a significant source of stress when dealing with additional stressors from the pandemic. Lastly, future studies may work to improve the response rate of the survey to allow for comparisons between perceived stress levels of the athletic teams. Once again, on behalf of myself and the UND Exercise Science Department, thank you for listening.